This morning, everyone.
Morning.
Great to have you with us, and we're really excited to be able to preview for you this new piece of research that we've been working on diligently for the past year or so. On as you can see here, the title DE&I and Safety: The Intersections, Integration, and Implementation Potential. So really looking forward to sharing this with you today. My name is John Doney. I'm our Vice President of Workplace Strategy here at National Safety Council. I've been with the organization about 15 years in a variety of roles, many of them involving research and best practice aggregation type efforts, similar to what we are going to discuss here today. So I know folks will be rolling in a little bit here as we go into the morning. So we'll get you off to an easy start here, talk a little bit about the background of all of this, and then go on from there. I will encourage you all, we do have both a chat function and a Q&A function. So if you have anything you'd like to share in terms of general comments or introduce yourself or share where you're from or things like that in the chat, please feel free to. And then if you have a question for me, I will do my best to answer it throughout the webinar. I'll try to spend a little time at the end answering any open questions that are left over. And of course, if I don't get to everything, I'm happy to share those my thoughts with you and answers to that offline. So why don't we go ahead and get started from there? We've got about 50 people rolling in here, and I know we have plenty more on the way. So here's what I plan to share with you this morning over the next hour. We'll do a little bit of an introduction around NSC, also talk about DE&I and safety background and context, and then we'll dive in really into the meat of the research work and the model that we've drawn out of that work that we've done over the past year, and then talk a little bit about where we're going from here, of course. And I see the note that chat's actually disabled, so no worries there. Thanks for that note. So do feel free to feel free to share any pertinent information or questions in the Q&A function if you care to. So first, a little bit about NSC. I think most of you who are on the webinar, given that it's an NSC-produced webinar, probably are fairly aware of who we are and what we're all about, but just a few moments to share the background here and why we're talking about this issue. So we're America's leading nonprofit safety advocate. We've been in operation since 1913, so coming up on our 110th anniversary this year, which is exciting. We have about 13,000 member companies, which cover about 41,000 work sites and millions of workers around the world, but primarily in the U.S. We also have, many other workers and organizations that we touch through our resources and efforts. Our mission, as you can see, is really eliminating the leading causes of preventable deaths and injury so that people can live their fullest lives. And that takes us in a variety of different places, but we focus primarily in three large areas: workplace and roadway, as well as a cross-cutting one, impairment, which obviously has implications in both workplace and roadway safety. So our core work and where we started from, stemming from the Triangle Shirtwaist Factory fire, was in the workplace, but we've expanded to really meet the needs of the U.S. and the world from a safety perspective, wherever they are and wherever they operate. And then that's really what we distill down here at the bottom of this chart. You can see we're really all about saving lives from the workplace to any place, and we follow the data to make that happen. So on that front, that's really what sets us apart and differentiates NSC, as well as provides us focus. There are many places we can show up to help people, but like any organization, we have limited resources and limited time. And so we really build our programs and approaches around data analysis and rigorous research. And a demonstration of that, you can see here our injury facts publication, which goes back to 1921, so not quite all the way to 1913. But you can see we originally published that in a pamphlet sort of format. It's evolved over the years, and nowadays you can actually go to our injury facts website, which is freely available to everyone, where we have all sorts of great data analysis and insight on how folks are getting hurt and killed in the workplace and on the road and elsewhere in the U.S. With some constantly updated sources of information. So as soon as new information becomes available, we analyze that, we put that on the website, and you can grab it the moment it's up there. So nice change in our ability to react to and synthesize some of this stuff over the years, but also just a tremendous resource for the public. And just as a starting point on why we're getting into the conversation around DE&I and safety, a little note here on demographics on the data trends, and you can see that this goes to 2021, which is the most recent year that the data is available. Always lags a couple of years from the Bureau of Labor Statistics, but you can see here that a couple keynotes to this slide. One is that white non-Hispanics experience 60%, so the majority of all workplace deaths, and that makes it tough sometimes to see subtrends occurring amongst other races, ethnic groups, other demographic factors. years. And you can see from this chart, particularly in the past 4 or 5 years, the fatality rates amongst the Hispanic and Latino population, as well as the Black and African American population, have gone upwards fairly significantly from the average, and from the other kind of demographic split. So something we've been paying a lot of attention to, and something that is reflected in our rationale to go after some of these issues and understand them better from a safety context. So I'll obviously get into a lot more of that as we go on into the webinar here, but just wanted to share that as a starting point for why NSC, with its data focus, has been interested in this issue. A little bit as well to share about what we do on the NSC front from a workplace side, and how this fits in with the rest of the work that we do. On the left side of this chart, you sort of see the traditional sort of nonprofit work that NSC takes on, our workplace programs, where we do a lot of research, a lot of sort of aggregation of information and analysis of information. From that work, we produce a number of free tools and resources and guidance documents, like this research report, which will be available in just a few weeks time for you all to see and engage with. It'll be a much lengthier report than this webinar will cover, but that sort of thing is something that we do an awful lot of, and there's a great variety of resources available to you out there from us. And then on the right side of this chart, NSC also does a number of things that are in the membership direction, in the solution provision direction. So we have a number of different tools, mechanisms, everything from training to consulting to membership and advocacy, and ways that we can help organizations directly. So really a full circle of activity that NSC takes on. And when we design research work like this, we design it with this sort of spectrum in mind, knowing that folks not only need to be aware of these issues and understand them and research them and analyze them, but need to be able to take action on them. So we'll share some of our recommendations on that front as we get through the webinar here. I also should mention for this particular piece of work, this is a grant-funded project, and it's funded by the Lloyd's Register Foundation. A little bit about them here, and you can see that their values certainly mirror the National Safety Council's, and that's how we think about these sorts of partnerships and grant activities. We want to do this work if it aligns with our strategy and our direction, and we'd love to do it with a partner who is of a similar mindset. So we're very appreciative to Lloyd's Register Foundation for their support and funding and partnership on this project. It's one of a number of pieces of work that we've been doing with them over the past several years. So thank you, Lloyds, for that. To talk about how this fits into maybe some of the broader pieces of how NSC sees the world of work and sees the workplace safety as a whole. I share this framework, which is the future world of work that we developed in the midst of COVID-19. As many organizations did, we were thinking about the future and where we were headed and trying to chart those uncertain waters. And we broke that down into a number of different dimensions after talking with literally hundreds of organizations and individual leaders, as well as surveying thousands of folks over the course of several years, into things that were about how work was done, work modalities, what the workforce was expecting and experiencing, and then the things that were enabling work to be done safely, and we thought would be a trend for the future. And that led us to these 8 trends for the future world of work that you see at the bottom. We've done a number of different research pieces on these different trends, including about a 5-6 page overview of these that you can grab on our website as well, on our SAFER website, which we can share in the chat or share as a follow-up with you. You see at the bottom, one of them that I think is a really important one for us in terms of talking about today is that whole person valuation, or understanding, that broader dimension of safety from a holistic perspective. You can see these represented here slightly more visually, if that helps as well. That whole human approach, maybe, you might have heard of the concept of total worker health, or you might have heard of dimensions of things like human organizational performance, psychological safety, psychosocial risk. All of those things fit in really nicely together, I think, as a whole human approach. I think DE&I and demographics certainly fit as a component of that as well. So that's really what began to push our interest in this direction. In addition to the data points we were seeing, we were hearing a clear need from professionals and leaders out there in the safety space that these were emerging trends for them as well. These were things that they were focused on. And we broke all of this down really into about 8 different areas in which we were going after from a topical perspective. So obviously many things we could have chosen to focus on from that long list of different ways that work was changing. And we broke this down into sort of these 8 buckets. And I've centered here for you, obviously, this well-being and whole person safety aspect that I've been talking about here. And really the research question, or the main driver for us, is not understanding these elements per se just to understand them. Do we want to understand well-being as well-being. We really want to understand it in the context of safety and health, in the context of occupational safety and health. And as you can see here, this research question broadly stated is, what do organizations need to know about impairment and risk? And how can we better address the whole person from a safety perspective? That includes everything about who you are and how you show up to work. So that's really it has been what has driven us to drive further into DE&I. I'll also share that another piece of research work that we've been doing in the interim, which has been about kind of grappling with this totality of new issues and topics, led us to this diagram, which is sort of a way to look at the dimensions of safety and health in 2023 and beyond. And one thing I want to call out here is that, as we looked at the different themes that we were seeing emerge from that research work, that pretty squarely put diversity, equity, inclusion on the map for us there. And you can see a number of other topics around that outer ring. Really, the upshot of this chart is to say that the safety and health profession is and always has been evolving. And our core EHS or OSH work is at that center of that circle, and it always will be. I think we've learned in the past decade or so that we need to put an operational philosophy or lens on this that leans into that human element, leans into human risk, human error, human decision making, and that's that HOP concept that sort of lives around our current conception of OSH or EHS. And then what we're seeing emerge in the themes and things we're hearing from folks and what's out there in the literature are sort of broadly pushing us in that total worker health, whole person dimension, as well as that environmental, social, and governance or ESG direction. Those are two major threads in the business world right now, generally speaking. And we quantify those things around the end, not to say they belong just to one of these major themes or major pillars, but there's a lot of overlap and crossover. Mental health, SIF prevention, psychological safety, DE&I, ESG, governance, ethics, these things all blend into one another, inform one another, influence one another, and become really complex at the end of the day. And so this work is about really detangling all these different things and trying to give us a clear path as to what we know, what we don't, and where we need to act from here based on what we have in front of us. So that's really how I would describe, the general arc of where NSC has been going from a research perspective in the past several years. And this DE&I specific work is really a sub-thread of that effort, meant to give us some clarity on where we go with this particular thread. So that's just a little bit of table setting so that you have a better sense of where NSC is, broadly speaking, on a number of these issues. From here, I'll go into a little bit more deeply in the background of DE&I, try to ground us in some of the core concepts there before we move into the safety-specific aspects of the work in section 3 here. But I would be remiss if I didn't start with a word on politics, because I do know that this is in some quarters, a highly charged issue. There's been, a lot of discussion about this, not in a safety context, but in a broader cultural, societal, political context. So the word I'd like to share on politics is just no. We don't. We are an apolitical organization. We're nonpartisan. Nothing that we share is influenced by or intended to be about political implications of these issues. This is really being driven purely from a safety and health context. That's our mandate and our mission. So we appreciate, from that perspective, you would try to approach it this way as well. And you may have preconceived notions on one side or the other around this topic. We definitely invite you to put those to the side for this purpose and think about this from a purely safety and health context for today. So that's really my one and only word on politics there. So in terms of DE&I and safety, I just want to give a short history from how we are kind of looking at this over the evolution of the past 40, 50 years or so. And interestingly, as we looked at this, I think, I sort of saw a real arc that mirrored sort of the direction that safety and health and risk management has taken over that same period. So, in the 1960s, when it came to the way we thought about DE&I as a culture in the US or as a society, was really legislative driven. That was the era of a number of different, major legislative acts that brought about some advancements in DE&I, including the Equal Pay Act, Title VII, the Age Discrimination Act, and I characterize that as the era of compliance. And really, when you think about it, 1970s, so right at the tail end of the 60s, we have the OSH Act being signed into law, and really that kicked off that era of compliance for us as well. That kind of quickly evolved into what I'd call the era of systems, in which we thought about how to better manage these things and not just check boxes from a compliance perspective. And on the DE&I side as well, that was sort of similarly what we were seeing. We saw a rise in diversity training. We saw the notions of colorblindness and equal opportunity sort of start to rise. So these were sort of second ring ways in which organizations were grappling with the compliance constructs that have been put into place. If we want to do these things well and not just do them, how do we address that? So that's kind of the evolution we saw from the 70s to 90s. As we got into the more recent years, the 90s to 2000s, I think there was a bigger focus on value from a DE&I perspective. There was a lot of research being done on productivity, on emotional intelligence, on the value of having a diverse leadership team or diverse teams working on problem solving. So we started to think about this less from a, how do we systematize it to how do we really embrace it and get value out of it. And again, from a safety and health perspective, same conversations were happening here. We're seeing the rise of not just management systems, but things like high performance organizations or high reliability organizations, or that Lean Six Sigma thinking that was driving us into really extracting value from and maximizing value from these activities. And then in our most recent arc, just before the present day, I think we've really gotten into that evolution of thinking about this from a human-centric perspective. So from a safety and health perspective, you see this in the rise of, or that arc from behavior-based safety to serious injury and fatality prevention and illness prevention to HOP, neuroscience, psychosocial risk, those newer concepts. And that's really about a human-centric perspective and trying to understand why we do what we do, not just punishing us for doing it. And that's where, from a DE&I perspective, likewise, we saw some real human-centric efforts, coming to bear, not just what value do you bring, but how can we best represent, include you? How can we support you with things like employee resource groups and things of that nature? So it was really interesting to look at these sort of very similar evolutions, I think, that DE&I type conversations and safety conversations have had over the years. And what I'd suggest that as we look at the present day is that, this may be, and this is a kind of a maybe a bit of a cheeky question, is are we in the era of equity now? Is that really the evolution we've made to get more specific, to think about how we not just treat DE&I as a conglomerate of different issues, but think about the ways in which we can actually take action and sort of fix things that we want to fix. And equity may well be the way we want to express that. So I'll get more into what we mean by all of that. And I've got a couple other great illustrations to tell you what equity looks like in practice. And you can kind of see, some different differentiations here of equality being giving everyone the same thing. Well, it doesn't quite work out as well for every single person. Equity is about leveling those gaps, right? So maybe to get us more a little bit in that direction, I want to share a little bit of definitions, because I do think it's important that we talk the same language. And I think when we don't, or we assume that we're using the same definition for things as others are, we can get ourselves in some real trouble very quickly, because we'll turn people off if we're describing something in a way that they assume differently, or they bring something else to the table on that. So these are definitions that we leverage from ISO, or the International Standards Organization, really familiar to a lot of us in the safety space, just because of big standards like ISO 45001. From a safety and health management system perspective. So these are how they describe diversity, the characteristics of differences and similarities between people. Equity being the principle that people should be subject to policies, processes, and practices that are fair as far as possible and free from bias. And inclusion, the process of including all stakeholders in organizational contexts. We also created a set of definitions from the research effort to really try to grapple with, typically we don't hear a lot of organizations talking specifically right now about diversity, equity, or inclusion. We hear them talking about DE&I as a construct, right? As a encompassing all of those things. And sometimes we hear them, add other dimensions of that as well. Often accessibility. So the way we're defining DE&I as a construct here for today is as an ethos, implying a set of combined strategies, initiatives, programs, policies, approaches, practices designed to include people, designed to ensure that they have the supports needed to equitably perform to the fullest of their abilities. So really trying to bridge those gaps between those three notions. And then we also have a definition for what we're calling DE&I informed. So a DE&I informed approach is an approach in which, in this case, safety and health strategies, initiatives, programs, policies, or practices take into account and attempt to integrate these DE&I principles. So DE&I can be a thing. A DE&I informed approach is kind of an active way to take DE&I as a thing and insert it into, integrate it in, and activate it in a policy or in an approach or in a practice in the field. So hopefully these definitions are fairly straightforward and make pretty good sense to everyone. But we felt that there's a little bit of a gap there in terms of the way we talk about these things. We often hear people talking about DE&I, and they're using it as a proxy for diversity, or they're using it as a proxy for representation, or they're using it as a proxy for a type of person. So these are really things that we'd like to try to avoid, I think, to give clarity to the actual issues at hand. I'll also say that, as we researched this and looked into this, certainly this is an evolving conversation. And it's an evolving conversation that has evolved alongside the way we organize our work and the way we think about work. And we think about work-life balance and other issues in that domain. And I think there are three big areas that are driving this evolution. One is an increasing understanding of the complexities and inequities within safety. So we've seen, a whole, group of work come together around things like total worker health from NIOSH, around things like the social determinants of health, which has been taken up by the Surgeon General, particularly when it comes to impairment and issues of that nature. And we've seen obviously a big upswing in human organizational performance principles and looking at human error as a feature of humans and not as a thing that we need to blame and shame. We've also seen a rise in what I'd call macro inequities that are influencing the workforce. Much research has been done to show sort of a compression of economic, accessibility and a rise in economic disparity. We've also seen, and we've studied this in our work for SAFER as part of our COVID-19 work, increasing disparities in education, healthcare, and food access. So we know those are also driving challenges within the workforce. And we also know there's increasing attention on issues related to DE&I outside of a safety context, much of which was brought on by COVID-19 and the disparities that we saw there, but also broader social justice issues that we see taking place in the US every day as well as around the world. And finally, demographic change. The world is changing, our workforce is changing. We have many generations in the workforce now, all with different drivers and perceptions and biases. So that, of course, leads to different conversations around diversity, equity, and inclusion than we had 5 or 10 years ago. So by nature, all of this is going to continue to evolve, and what we're sharing is certainly a snapshot in time. So worth mentioning that as well. But I would say that, all of that complexity, all of that change, all of those big constructs and concepts, a lot of things to put on the table. And I think, as we look at this as safety and health leaders and professionals, there's a need for clarity. There's been advancements in theory. There's all these evolving conversations. There's a lot of anecdotal conversation and evidence around some of these things and linking these concepts to safety directly. But there's been very little scientific research on this intersection and on the integration of these topics and how you actually implement them. And so that was really the genesis of this work, is could we start that conversation in a research-focused way rather than just an anecdotal way? And so what you see here is really the short list of research questions we wanted to answer with this work. What is the landscape out there? How do they align with safety? How do they engage with safety? And does DE&I improve safety outcomes? Is it material? And if so, what are the strategies and tactics that hold the most promise for operationalizing it? So a pretty ambitious slate of research questions, I would say, in some ways. But one that we felt, was necessary to get started with, because if we didn't, we're not sure who else would. We don't know whether this research would ultimately be done. So we started with a literature review, as most good research does. We culled from about 2,500, 2,600 articles into 40 that had the most relevance and that were directly in the space of safety and DE&I. Lots of great work that's sort of on the edges of that, particularly around psychological safety, but not much over the past 5 to 10 years that's purely about safety and DE&I. We follow that on with a survey of about 60 senior safety, HR, ESG, and operations leaders, and then a structured interviews to dive deeper with about 10 representative leaders from some of those organizations and from elsewhere. We also had a year-long effort, actually about an 18-month effort, to engage a number of experts and other stakeholders in this space. So we had a cross-disciplinary expert group that we brought together to influence and inform the work, and we held a workshop on that topic about 4 or 5 months ago, 3 or 4 months ago now, to really uncover any additional bias or issues we wanted to get out on the table. A few notes, though, about limitations. From a research perspective, always important to recognize those. The literature review really was scoped just at the past 5 years, and that's because we felt that, knowing that this is an emerging issue, we didn't think we would see much going back. We did certainly catch wind of major studies that have been done in the past that we referenced by virtue of citing through existing work. We also will note that, while we had diverse stakeholder representation in our surveys, in our interviews, in our expert group, it was also a small sample and shouldn't be seen as representative of the U.S. business or of global perspectives. So we do have some biases there. As well as I think we have sort of a maturity bias in a way, in that our organizations generally that we spoke with and engaged with tended to be biased toward larger organizations. Those organizations generally tend to be more resource rich. They tend to be able to activate and engage on issues that maybe smaller and medium-sized businesses can't yet. So some of the answers you'll see, I think, reflect some of that maturity bias to a degree because of the larger organizations' sizes. And also with much of this, we were relying on self-reporting of the existence of policies, practices, or beliefs in these organizations. So is it there or not? We didn't go independently verify, and that's often a limitation on studies of this nature. So want to be transparent and upfront with the research limitations, of course, though. So that's just a little bit of background from how we did this research, why we did this research, how it fits into the broad context of NSC and safety in general. So hopefully that's been good to give us all a level set here. And now really with the rest of the presentation, I'd like to move into what we've learned from the research. And I think it's important to tee up a lot before we get there, just so we're in the same space together. But now we'll kind of get into some of the meat of this. And I apologize because some of these are going to be fairly text heavy, but I'll try to break this up with some good charts and graphs as we go in. I'm going to break this up as well into what we learned from the literature, as well as what we were hearing from practitioners, because I think those things mirrored each other to a degree, but offered us some really interesting observations in terms of what we're seeing conceptually and what we're seeing in reality and in practice. So I'm not going to dwell on this slide because I'm going to get into each of these here separately, but I just want to share that I'm going to break this up into the things we found that seem to be pointing toward linkages between DE&I and safety, challenges related to DE&I and safety, and then key takeaways for approaches as to how we can get there further. So the first real linkage I want to point out is the systemic inequities linkage. So to put that kind of in a concise way, systemic inequities that affect worker health and well-being outside the workplace also impact workplace safety, health, and equity, safety and health equity. So a couple of good examples of that are, I mentioned earlier, access to food, access to education, access to healthcare. These are things that occur outside the workplace, but they impact workplace safety and health because we know quite a bit about, for instance, the impact between and the influence between well-being and safety, or fatigue and safety, or other issues of that nature. So that's kind of at a broad basis what we think we know anecdotally. What the research told us is these systemic inequities show up in lots of other ways too. One big one is in the ways that contract and temporary workers and contingent workers show up when policies are often based on full-time employees, or kind of the employee contingent, not the worker contingent. So that's an inequity, that's a work modality that has nothing to do with really the safety and health of the workplace itself. It's a arrangement that exists kind of in the workforce, writ large. So that's a big one that we don't often grapple with. Precarious employment being another one. So, if you are a contractor, or if you're a temp worker, for instance, in particular, or if you're in a cyclical work cycle, construction, where there's kind of, you take your job, maybe there's nothing that comes by for 3 months, and then you take another job. There's a really big negative correlation between job insecurity and mental health, which is most prominent in youth, women, and immigrant and lower educated populations. And we know that mental health outcomes often have a big influence on safety and health, physical safety and health outcomes. We've also noted differences in safety and health outcomes between immigrant and native populations. This is also impacted by ethnic origin, age, residence time, reason of immigration is another big factor there. Did you immigrate, from a refugee crisis sort of situation versus you chose to immigrate to find a better opportunity? Those all impact safety and health outcomes according to the literature. We also know that for hard to reach workers or underserved populations, there's lower workplace disclosure of incidents, potentially for stigma, fear of reprisal, fear of lack of promotability and job insecurity. If you say something, are you going to get fired, particularly if you're a contingent worker? And then there's potential for systemic discrimination, particularly in high-risk industries that hinders safety and perception. So, in higher risk occupations, so things like agriculture, for instance, potentially areas like construction, mining, utilities, those sorts of areas where there's pretty much high-risk operation all the time. There's a real need to identify vulnerable groups in those higher risk occupations because if we know that they're generally at the most risk or have different sorts of safety and outcomes writ large, particularly in high-risk occupations, that should be an even bigger driver for us. So, again, this is about what happens outside of the work context and what influence it has in a work context from a safety and health perspective. So that's a real fundamental linkage, and the reason that we see that as sort of linkage number one in the study. In a much more tactical sense, another big linkage we found is that DE&I informed requirements have actually begun to emerge in the design and uses of personal protective equipment. So although this sits at the bottom of the hierarchy of controls, it is an area where I think we have a lot of opportunity. And we've seen a growing body of literature on DE&I informed workplace and tool design. We've seen the market begin to respond to this, particularly when it comes to women and smaller sized people, in terms of what they may need to not be at risk for pinch points or getting wrapped up in rolling machinery. I'm a short person. I've been at work sites where my high vis vest is sort of billowing off of me, and if I've got a rotating plate or a press moving a few inches from me, that's really not a good situation to be in, and it can lead to very serious outcomes. As far as what the literature is saying, you can kind of see I've been talking a little bit about that. There's also been some notes that the construction sector is potentially more underserved than others in terms of accessible safety equipment. But we've seen organizations taking some proactive steps, and we saw a great study on what Skanska has been doing, using women's anthropometric data to design and make accessible PPE more readily available. This also plays out in ergonomic tool design. We've seen great potential to, for instance, 3D print tools to fit the worker's hands and arms and legs and everything else. So tailoring that to a diverse workforce. There's lots of great anthropometric data available at regional, at state, at federal levels, at global levels that can be leveraged and used. I've got a facility in Washington State, or in this region, I can go grab data on what my worker population probably looks like, even if I don't have that from the data I've been pulling. And you can use that to use for your PPE and ergonomics interventions. We also saw in the studies the need to recognize the importance and necessity of inclusive design. So bringing your people in on equipment design, on PPE design, in order to leverage knowledge transfer. Folks who've been doing jobs for 20 years, 30 years, using poor tools, poor PPE, and helping you make it better, calling out those specific risk factors that might not be seen without that perspective or inclusive perspective brought at the table, and informing risk management strategies at large. So another great kind of more, I'd say, proactive linkage that's a bit more tactical and tangible. And then I mentioned psychological safety earlier, and there's obviously, we've seen in the literature, a big connection between DE&I and psychological safety that's been well established and well studied in the research, that psychological safety is enhanced when DE&I informed approaches are taken to psychological safety. But we've seen less research between general DE&I and physical safety. So there's some things we can do sort of from the A equals B equals C principle there to get us to some safety outcomes, but it hasn't been quite as direct as we'd like. But I will say, the literature certainly told us that the definition of psychological safety is much better established. And Amy Edmondson's definition that you can see here is probably the most common and popular one that's been leveraged nowadays. We also see in the literature that psychological safety is critical to enable DE&I efforts, so it works both ways. Trust and psychological safety of a team, of an organization, is absolutely essential to be able to create an inclusive work environment. If your folks don't trust you, they're never going to take it seriously when they are asked to be included, and you're not going to get the right or real information. And I think we're seeing a growing understanding of the linkages with physical safety. Including studies that try to look at safety outcome performance based on workplace characteristics, employee demographics, climate factors, cultural factors. And we've done some work directly on this in our SAFER work that shows some strong positive correlation between higher levels of psychological safety present in an organization and higher levels of perceived physical safety. So these are worker perception surveys that we've been doing for a number of years now within the SAFER work, and points to the inverse as well, where there's lower levels of psychological safety, there's lower levels of perceived physical safety. Now, we haven't cross-referenced that with actual safety data outcome from those organizations to preserve anonymity of survey respondents, but at least anecdotally, there's some trends in that direction from a correlative perspective. So those were the three big linkages that we saw in the literature study. But we also saw a couple of big challenges. And one of them is the lack of functional integration. This is one that we'll certainly see mirrored in the practitioner data when I get to that in a few moments. But to put it shortly, a lack of integration between safety and health, and particularly human resource functions, is a big barrier to identifying and addressing the impact and relevance of DE&I to safety. So, we know that from the studies that we looked at, there's a broad relevance of culture and safety policies. We know that safety culture and culture, organizational culture, and cultural background are all sort of different dimensions of this, and that diverse cultural backgrounds can reflect understanding, perception, and prioritization of risk and safety measures. If any of you have ever worked in different regions of the US or worked in different regions globally, this is pretty obvious when you first walk into a facility or a site or an organization. Just the prevailing culture and attitudes tend to be drawn from the region of the world or the culture and demographics of the workforce and the leadership. And we also know that cultural factors such as power dynamics can have a chilling effect on safety. The study in particular that we saw referenced was, cultures in which sports metaphors tend to be more common from a work perspective versus family metaphors tend to be more common. That varies pretty broadly between cultures. And in the US, we talk a lot about team mentality. We do a lot of sports references. Other cultures are more about, culture as a family. And in the US, that varies, of course, as well. But I think that, that's a really good sort of thumbnail example of, when you think about the way you talk about that, if that's not your cultural background, if you don't come from a culture that, talks about things that way, you don't have that in. And even more so if the power dynamic at a leadership level is different from the power dynamic or the culture at a workforce level, the leadership is from one cultural region, the workforce is from another, that can really have some big factors in terms of safety outcomes. We also know that as much as we recognize cultural differences being important, we rarely, if ever, talk about them in safety policies. And this is potentially due to limitations on data, potentially limitations from a safety and HR integration perspective. It may also be fear of misspeaking or outstepping or saying something negative or implying something negative in policies or positions. So a couple of different drivers there. We've also seen from the studies that there's definitely coordination necessary to integrate these factors, and it requires the effort from both safety and HR. We also know another big challenge, and again, this will be mirrored in the practitioner data, is there's a lack of common reporting measures, a huge barrier to get to the relationship between DE&I and safety. And when it comes to our safety metrics, they often overlook those demographic factors. In some organizations, we do collect that data, but we don't always, and we certainly don't look at that when it comes to absenteeism or causal factor data all the time. We might look at it from a pure injury rate perspective, but rarely from other sources. There's lots of great source data available to use and to composite for us, but we don't often use it. So, a few studies reference really good global data sources that we could go after. But I don't see a whole lot of utility of that in the field. I don't see a lot of folks leveraging that data or even knowing that it exists. So we want to call out a few of those sources here that you can see. And then, of course, lack of standard definitions. I had to spend time up front with us all here talking about our definitions. And so those are obviously ones that aren't always common. But classifications like precarious employment or these other factors that might be influencing safety outcomes that we don't always have really strong understandings and definitions of. Fortunately, in the research, in the academic literature, we did see things that were pointing us toward potentials to enhance equity, and we know that's an evolving process. But I'll short message this slide just by saying, we need to better understand the broad things in play, those external factors, to get to some of the things that are happening inside our workforces. Just as something that's happening to someone's mental state or someone's well-being state outside the workforce influences what happens inside the workforce. Something that is affecting them from an inclusion or equity perspective or diversity perspective really shows up in the workforce as well. And that second bullet point I'd really like to call out here is that there's two main strategies in play in most organizations right now. One is a diversity blind strategy. We're going to do it the same for everybody because that's the way it should be done. That's the fairest. And then there's a diversity conscious set of practices, which is to sort of focus on the value of difference and the fact that everybody is different, and we need to treat people differently in order to give them equal outcomes. And this is obviously a very contentious conversation and one that leans into the political aspect. But I'd just say that we recognize that there are two big threads here. I think that I think we're finding more material advantage from a safety perspective in being diversity conscious than we are in diversity blind, but want to recognize that there are ways to approach these issues that can be valid from both perspectives, potentially. And finally, just a summary here, and this may be the takeaway chart of the major aspects here: linkages, ways to enhance, challenges, the big gaps, and potential best practices. So if you wanted to take away a summary of this to your leadership and say, what did we learn here today from the literature? Here's sort of that capsule of that for you. So I saw a note that about the slides, and yes, you will get all those slides after the webinar here, so you can take these away with you. And I did see the question about PPE. I do intend to answer that. I just want to do that once I get to the end of the conversation here, if that's all right. Because I have a fair bit to churn through here in the next 20 minutes. So I'm going to speed up our work here a little bit so I can get to some questions here for you. So want to pair this literature review with the more active side of what we talk to with our practitioners. So much like with the literature, I want to just sort of provide you with the summary categorization of what we saw from practitioners here. A couple of big themes on interconnections, on but integration potential, challenges with operationalizing, and then emerging best practices. So the first theme on interconnectedness and integration, the interconnectedness between DE&I and safety seems to be clear, but there's space for further integration. You can see here, if you look at the first two bar charts here, virtually everyone, about 97% of folks strongly agreed that DE&I is a critical factor in my organization's safety and health policies. And similarly, most of them, about 89%, the DE&I informs my organization's general safety and health procedures. So obviously folks are thinking about this. Obviously it's already interconnected, at least on the face of it, at least on the messaging of it, right? But we do think there are some implementation disconnects. So, on this chart, you kind of see on the left side, a big group of folks, about 70% or so here are saying that the organization acknowledges the relevance of DE&I, but they say that its direct impact on workplace safety may vary. So 3/4 of the respondents to the survey felt that its impact, really, although they agree from a statement perspective that it's important, it's connected, they would also hedge to say that it may vary. So what does that really mean? And then when you look at the question of, your organization on the right, considering DE&I in risk assessment and developing strategies to mitigate DE&I risk, we see, 64% say that they actually do that. So, interesting that, although 90% of folks are saying, hey, this is really important and connected, when it comes down to what we really believe, when we ask you, does this vary? Is this really true? Some people take that out and say, hey, they're not sure that this is actually something that makes sense. They also say, maybe we don't always actually do this in the field. So, if 40% of us say it's important but aren't actually doing anything with it, that's a pretty big chunk. And you can see throughout here, I've sprinkled some direct quotes from the interviews in these slides. And it's interesting because this one is actually a really good representation of that diversity blind perspective. It doesn't matter who you are, what you look like. But I think, if that's true, what do we do with that when it comes to inserting this or integrating this into our actual activity? That's a big conundrum, right? Another thing that we saw from the practitioners, and this is probably pretty obvious to most because this is true of anything in safety, is that there are differences to approaches and differences in how we can approach things based on jurisdictions, industries, and organizational design and the way our work's set up. Some of those are cultural in nature, so you can see that power dynamics. I've talked a lot about that earlier already. Some of those are regulatory, jurisdictional. They might hinder our global approaches. If you've got more restrictive things here versus elsewhere, and you're trying to do a systemic approach, you're going to have to thread that needle a little bit. And then also industry factors. So industry that tends to have higher concentration of certain populations, potentially may have more challenges in integrating DE&I into safety and health. So in particular, what we saw from the stakeholder conversations was that construction, mining, manufacturing, which tend to be a bit more male dominated, tend to have a little bit more of a challenge in acknowledging the influence of DE&I in safety. And that may, be a closed circuit just based on what they're seeing and experiencing day to day. Or it could be just a blinders on in terms of, not seeing those things that they're not seeing, right? So, some really interesting aspects there that we need to build in when we think about how we actually go to do these things in the field. The other thing, and again, this is obvious and true of everything in safety and health and any organizational structure, is that there's varying maturity across organizations in terms of how they're approaching DE&I. And the way we sort of saw this bucketed is into four kind of categories. That are sort of really a spectrum of maturity in a way, from liability to culture. So organizations may care about D&I and safety from different rationales and different viewpoints. They may care about it purely from a compliance perspective. They may care about it as a lever to increase engagement because they believe that's important. They may care about it as a lever to retain talent because they believe that's even more important. Or they may care because they believe it's a big part of their culture as an entire organization. And I think, when you look at this similarly from a safety perspective on a maturity curve, this maps pretty well, right? If we start our journey maybe from a compliance perspective, we tend to get to a point where we embed it and ingrain it into everything we do. And that's really a similar arc that we're seeing across DE&I practices in the organizations that we studied. Now, the second big theme in the practitioner work, and again, this is sort of mirroring the literature, is there are big barriers to operationalization of these things in the field. So, one of the ways we wanted to look at that was from a data and resource perspective. And so we asked, hey, does your organization have, this is about 61 organizations we studied. And again, I think there's a bias here toward more mature organizations, so take that as you will. 85% of them said that they were gathering demographic data alongside workplace injury data. So it's a pretty big chunk, and I don't think it necessarily mirrors the entire market. And then we look at on the right, which function primarily collects and uses this data, almost entirely safety and health, because it's safety related. But that means in most cases, you're not seeing end users in HR, you're not seeing end users in executive management for the most part use and deal with this data. And we know that we need as safety and health professionals those functions to lean in and partner with us here, because we can only move this rock so far purely within safety and health. A lot of the time it needs to really extend out into these other functions. So we're kind of collecting all this data and using it in a bit of a vacuum in a way. And so, our inability to have this data being used externally in other functions is hampering our ability to make action happen. We also know that barriers at the organizational level, typically in the way teams are set up and the way organizations are set up structurally, impedes progress. So that was another big insight from the practitioner study. And you can kind of see here sort of a distribution of what level of influence different functions in organizations have on developing D&I informed safety and health policies, practices, and procedures. So obviously, the head of safety and health is going to be the key and significant contributor in most cases. But then you interestingly see, you go down this chart and you have a few other folks, a COO and a CEO, who are almost as influential as a chief D&I officer, if it exists, or a head of HR or people, if it exists. So some interesting dynamics there that, safety and health is certainly leading the charge in developing these policies, but we don't always have alignment with all of those other functions in our organizations. And a couple of the quotes, here kind of illustrate more so what we are hearing, that there's differences in perspective, opinion, different power structures, policies and approaches have to be different based on that, or there's a perception that they do. And this oil and gas and chemical organization told us, well, the departments need to communicate properly in order to effectively manage it. And we know that that's not always the case. So interdepartmental communication and cross function often kills these efforts before they start. But fortunately, as we talk to practitioners and stakeholders, we did see some really promising practices emerge. And we believe that there are best practices emerging to improve integration and implementation of D&I and safety in the field. So we did a case study here, which I've shared the upshots of, and you will be able to find this in greater length in the main paper when it's published. That sort of lays out how one representative organization is looking to do this, starting with vision and policy level, looking at different channels to activate this in the field, resource groups, learning paths, messaging, events, all these sorts of different tools in the toolbox, looking at the actual interrelationships and synergies, acknowledging the barriers. You can run through this whole list here, but I think that what we're starting to see is these pathways are emerging to do this intentionally. There are models that are starting to emerge to leverage and use as you think about this. And I'm going to share, beyond just this one case study here, what we're seeing as, the way we can get at this. So, I think one cluster of best practices is around the role of the leader. and the fact that the integration of DE&I and safety must start at the executive level or must include the executive level. So that can include integrating DE&I and safety in your business code of conduct as core principles, can include addressing DE&I and safety as a full spectrum exercise. So figuring out the totality of starting with the executives, engaging middle management, engaging the workforce. All of those things are key. This can't be just a push down and let's ask you. It has to be everybody's skin in the game here, and there has to be a closed feedback loop on making action happen. And then certainly from an executive level, there needs to be a mandate to enhance cross-functional collaboration, and it can't be just a scarecrow pointing both ways. Safety saying HR needs to do this, HR saying safety needs to do this, or lack of clarity on who's on first on these things. It really needs to be clear and mandated from the top. As well, sort of similarly, though, I think there's an emerging threat of best practices on the engagement and workforce side. We saw about 5 different major areas where we were seeing best practices emerge. One being, and this sounds really simple and easy, but we know it's not, is you need to create a safe and inclusive environment in the first place in order to get to these real integration opportunities. And that's, physically safe, but also psychologically safe. If you can't do that, you're not going to have folks stepping up and speaking their minds and actually telling you what the risks are and ways that they can engage in the ways we need to work together on this. You need to include employees and workers' feedback, including your contingent and temporary workers if you're able to, and you need to back up that communication with action. And that goes back to that closed feedback loop. If you talk this game about what you're going to do and no one actually sees it happen and they don't experience it in the field changing for them, that's really going to diminish and destroy and erode the culture, the confidence, and that safe and inclusive environment that you try to set. We also believe there's a good set of practices emerging and maybe being driven by ESG as a primary factor that sets DE&I targets and C-suite goals and remuneration. I will say take that one with a caveat, because I think we all know from a safety and health perspective that when you begin to bring incentivization into a conversation, you're rewarding outcomes and not necessarily action or motivation. So definitely be careful whenever you're bringing incentives into the conversation. And certainly, this is not static. It hasn't been static. We're catching up to a 10-year conversation here in a lot of ways. So, need to adapt CD&I and safety goals to changing trends. Both macro and external trends that are happening outside, as well as internal trends in your organization. So just to summarize those broad recommendations, this is sort of the 8 that we came to, 3 on the sort of executive side, 5 on the workforce side, but kind of tried to put these in an order of, priority in a way, so that, you can see where you might need to start if you haven't gone there yet. So you can kind of see those organized out. And of course, we'll have some more guidance for you in the main report. This is really just a summary chart of everything I've been talking about, so I won't dwell on it too long, but could be a good useful one for you as you go back to your organizations. Maybe more material to us, and something that I'd really like to hone in on, is there's also 4 recommendations we have that are very, very specific to a safety and health context. So one is data collection, which is that if you aren't doing it already, you need to collect demographic data related to safety and health successes, near misses, observations, and incidents, not just injuries, and really look for those characteristics that may be hidden, and need to make sure you're using this information proactively, taking into account privacy and not using it for punitive sources. Second is you really need to ensure diverse, inclusive involvement in risk assessment and hazard identification activities, direct workforce participation, a trusting environment in which people can speak up. There's no fear of raising concerns. And this shouldn't just be your 4 or 5 folks who are closest to the boat. It really should try to be representative of your workforce. Third, that you need to embed and take a DE&I informed approach to observations, incident investigations, and root cause analysis. Look at those drivers of work activity or behavior, and I use that in quotes because we're not talking about behavior in a negative sense. We're talking about the way it informs the actions and thoughts that we have, and really think about how you do that in whatever observation programs you have, however you bring together stakeholders to talk about the whys behind an incident and get to systemic root cause. And then if you are in a position where you have a serious injury, incident, illness and fatality prevention program, or you have a human and organizational performance program, really start to make those connections between DE&I and these issues. If you think about human error, you think about decision-making, you think about precursors for serious injury and fatality, there are some really DE&I informed aspects here that could fit in, including, equity, drivers of work activity and behavior as similar to those proactive observations and incident investigations. So, four big specific things on the safety and health front that I think, you could take all the other organizational stuff here to one side and say, well, I just want to do this in safety. Okay, look at these four elements, but I would encourage you that all 8 of these things are pretty important in terms of the overall organizational context. Just to sum all that up, and to really put it all in one place for you, we have this model that will live inside the report, where you can kind of see this overall chart from organizations moving from a lower comprehension of DE&I and safety to a higher comprehension of DE&I and safety, including both workforce and stakeholder engagement and executive engagement. That sort of maturity chart that I mentioned, going from compliance to culture, the recommendations that we have here at the bottom here for you, both safety specific and just more general best practices. So this is really the presentation in a single chart, if you wanted to take that home with you. And we would encourage organizations to sort of consider where they are on this model, and consider how they can best move to the next space on this model. A few other quick thoughts before I answer a couple of the questions here. I also want to mention that DE&I is not monolithic, that it often comes across that way, but each aspect can be unpacked, and each aspect does require thought, care, and attention. I used that sort of tree and ladder chart earlier too, those images to describe some of these things. But I think one of the things that appeals to me when I think about our systems mentality from a safety and health perspective, ultimately what this cartoon shows to me is there's a systemic problem with the tree. Right? The tree is maybe our work environment here, right? Ultimately, we find lots of ways to try to get both workers here to have equitable outcomes. And there's lots of ways to do that. But really, if we want to get to justice, if we want to get to systemic problem solving, fix the work environment, fix the tree. If you can do that, you don't need to have different types of things here to get each worker to have the same outcome. So I think that's a really nice upshot, and it speaks to being able to look at these things in different channels, not just looking at them all at once. One other thing that will be in the report that I think is really important to share here too, is we want to provide you with some really hands-on tools to get to these things. So we have a questionnaire in here that we've adapted from other sources, that talks about an equity lens, and how you can put an equity lens on any decision, safety or otherwise. So a great 6-step, sort of question chart that if you're starting a new policy, reviewing a policy, maybe bringing in a new work structure or form, you can look at these and talk about these as a starting point for your organization and adapt them and use them as you will. You can also take something like the hierarchy of controls, look at where your interventions and risk mitigations are, and think about where DE&I fits in, where these different principles, where equity, where inclusion, where diversity fit into this puzzle, right? And so I've kind of charted a few of those out for you here, but there are certainly more. And that extends everywhere from the very obvious PPE things that we've already talked about, all the way up to elimination and engineering controls. NSC will continue to do work in this space. We're going to conduct additional research as we go. We have more research coming in particular in MSD and equity that'll be forthcoming quite soon. We're going to continue to convene stakeholders on these issues, talk about them at our events, and you'll see the NSC Congress and Expo, as well as our Future of EHS event coming up here in October and February. So please join us for those if you can. And we do have this full report that this webinar has been based out of coming within the next few weeks. So be on the lookout for that. It will be published under Lloyd's Register Foundation as an insight report. We also will have a longer version of that available to everyone that covers everything that we've studied over the past year or so. So I will say thank you and get to a couple questions here because I have about 3 minutes left. I know I talked fast and covered a lot of information. So if you have any questions you'd like to dig into things deeper, please, my door is always open by email, and I'm happy to have in-depth conversations with you on this. So the first question that I got way back at the beginning of the presentation, about halfway through, was around PPE and what PPE we're referring to specifically. So most of it, I think, is the answer. So if you think about everything from safety shoes to high-vis vests to safety eyewear to
goggles and things of that nature, all of those potentially can be ill-fitting and can be not fit for purpose for the worker. I'm 5'6" and about 120 pounds. I fit the bill for maybe an average size female employee for a lot of you in some ways. I often go into work sites, and I do this all the time, and it is a rare occasion when there is PPE that I find that is not ill-fitting. And that creates, three problems for me off the bat. One, I can't walk around safely. Two, I've got pieces flowing around behind me that could get caught or trapped. And three, I can't see everything and my peripheral vision's impeded. So I bring my own high vis vest, I bring my own safety shoes, and I bring my own glasses. And that's something that you're putting on the burden of the employee to do. You're also putting a burden on the employee to speak up because they even realize it's an issue. They might not realize it's an issue until they see it happen or they experience it themselves. And so I would just say, those are three big ones. Obviously, there may be more specific PPE to your particular risk, factors such as gloves that may be important, or it could even be things like, harnesses that may be ill-fitting. So just encourage you across the fleet of your PPE to really look at your workforce, who's using it, and is it fit for purpose. So just wanted to call that out. So pretty much every type of PPE. The second question I got was, how does depression fit in with this? And I'd say that it definitely fits in as an external factor from a mental health perspective, from a mental distress perspective, that certain work arrangements, certain cultural arrangements, things that you have outside the workforce. Maybe you're dealing with a particularly tricky family issue. Maybe your parents are in ill health, or your children is sick, what child's sick, and whatever it may be. That might be temporary, mental distress, and then there may be long-term mental distress. Definitely has an impact on safety and health outcomes. I think we've seen that studied fairly significantly. But we also know, that it's part of that composite or that fabric that makes you you. And when it comes to, being inclusive and thinking about how we communicate and talk to folks, we need to take that into account as well. So I think that, it's a sort of a tertiary issue in the big puzzle of all these different pieces. And that's part of what makes this so challenging. The interconnections are just like this in lots of ways. So what we're trying to do is just put these out into streams for everyone, so that we can kind of look at this with some clarity and understand the way in which we can address some of these issues and start to work away at them, rather than feeling like we have to climb this whole mountain at once. Saw a note there that we've been about ergonomic fitting PPE long before DE&I, and that's true. And I think that's really important. And ergonomic tooling is absolutely important as well to prevent injuries. But what I see in the field is not, always reflective of what we wish would be being done. So I think we still have some work to do there. So I'm about out of time. In fact, I'm a minute over. So I appreciate everyone sticking on. We'll be getting all this information out to you after the fact here. Welcome further conversation. Thanks for your attention, and look forward to sharing more with you as we do additional research here. Have a good morning and a good rest of the week. Bye-bye.